Since 1986, Dawn E. Hardy-Holly has been providing not only psychotherapy and hypnosis, but also training to hundreds of people from all over the United States. Most notably known for his extensive work with using medical hypnoanalysis, Dawn is sought out as one of the top trainers in the country for this modality. He has served as president and chairman of the board of the American Academy of Medical Hypnoanalysis. Dawn is here today to discuss stress management.
Hello, this is an illustration that I developed to explain stress in our lives. If this is a barrel or a tank that represents all of your stress, just imagine that down here there's a normal amount of stress. In this region, you have to have this kind of stress because it's good stress. It's the kind of stress that helps you meet deadlines. It even helps you get up in the morning. If you didn't have it, you would be like what they call the boneless chicken farm. You wouldn't have any motion at all. If that stress, though, increases and it creeps up, it gets up here into the danger zone. And in the danger zone, this is where all of us begin to have symptoms of stress. Symptoms could be like muscle tension, irritability, things like that. But that's good because it says, hey, you're under stress, you better open this release valve down here. The release valve could be exercise or talking to someone, relaxation, meditation, self-hypnosis, etc. But if you don't do something about it, it can creep up and creep up until it gets up here into the chronic zone. And in the chronic zone, that's where we need help. We need somebody to talk to us, to counsel with us. We may even need medication in the chronic zone. So it's important, if you realize you're in the chronic zone, to ask for help. But eventually you can get it back down with the proper help into the danger zone and then into the normal zone, and that's where we want it. Now some people kind of teeter-totter between the normal and the danger zone, kind of go back and forth, and then something major happens. For example, they may lose their job, or there may be a change in their family situation, like a divorce or whatever. And in that case, a lot of times, bang, you're right up there in the chronic zone. And that's when it's best to ask for help. So this, if you look at this, I'd suggest that right now you decide where you are in this barrel. Are you here in the normal zone? Are you in the danger zone or in the chronic zone? And kind of keep an eye on it just to be aware of where you are any particular day.